In chapter 10, it is all about poisoning. So, swallowed poisons, many substances in home or work settings are poisonous if swallowed. For swallowed poison, do this. First, determine the poison. Second, call Poison Control Center 8002-222-1222 for responsive victim and call 911 for unresponsive victim. Food poisoning. Symptoms may begin soon after eating or within a day. For food poisoning, do this. First, have the victim rest. Second, give fluids. And third, seek medical attention. Inhaled poisons. In work settings, various gases and fumes may be present. Unless you know the specific treatment for inhaling gas, care for a victim of suspected gas inhalation the same as for carbon monoxide. For inhaled poisons, do this. First, move to fresh air, then call 911, check ABCs, and give care as needed. Drug overdose. A person under the influence of illegal drugs or having an overdose of a prescription medication may have a wide range of behavior and symptoms depending on the specific drug. For drug abuse, do this. First, check ABCs and give care as needed. Second, call 911 for violence. Call 911 for overdose. Then call Poison Control Center 800-222-1222 for minor symptoms. Poisons ivy, oak, and sumac. Contact with these plants causes an allergic skin reaction in about half the population. For poison ivy, oak, and sumac, do this. First, wash area. Then, if severe, seek medical attention. Then third, treat the itching. For human bites, do this. First, clean the wound. Second, control the bleeding. Third, cover the wound and seek medical attention immediately. For snake bites, do this. Call 911, then keep bite below level of heart, then wash the area, then apply the cold pack. For tick bites, do this. First, remove the tick with tweezers, wash the area, apply antiseptic and antibiotic. For bee and wasp stings, do this. First, remove stingers with edge of credit card or knife blade, then wash the area. Third, apply cold pack, then observe victim and call 911 for allergic reaction. For scorpion stings, do this. Call 911 if needed, then monitor ABCs and give care as needed. Third, wash area, then apply cold pack, then seek urgent medical attention. In chapter 11, it is all about heat and cold emergencies. So, cold or hot environment can cause medical problems if the body is not protected from temperature extremes. Cold injuries, exposure to cold temperature can cause either localized freezing of skin and other tissues called frostbite or lowering of whole body's temperature or called hypothermia. For frostbite, do this. First, move victim out of cold and warm the frostbitten area. Second, remove constructing items. Then, protect between fingers or toes with dry gauze or floppy cloth. Fourth, seek medical attention. And if severe, use lukewarm water and protect and alleviate the area. For hypothermia, do this. First, monitor the ABCs and call 911 if hypothermia seems severe. Second, move victim out of cold, then remove any wet clothing. Third, warm the victim with blankets or warm clothing. Fourth, seek medical attention. Heat emergencies. Heat illnesses can result when people become overheated in hot environment. Heat cramps are least serious and usually first to occur. Heat exhaustion develops when the body becomes dehydrated in a hot environment. Heat stroke, when a seriously high body temperature may develop from heat exhaustion. It is a medical emergency and if untreated, usually cause death. For heat cramps, do this. First, stop activity and rest in a cool place. Second, give a sports drink or water. For heat exhaustion, do this. First, rest in cool place and loosen clothing. Second, raise feet 12 inches. Then give sports drink or water, then cool the victim. For heat stroke, do this. First, call 911, then move it to cool place, remove clothing, cool with water, keep cooling until temperature drops to approximately 100 degrees Fahrenheit. In chapter 12, it is all about rescuing and moving victims. Before you can give first aid and basic life support, you have to reach the victim. Sometimes the scene is dangerous and you must stay away or take special precautions. Fire. When you see flames or smoke, a fire alarm surrounding, do this. First, remove everyone from the area. Second, call 911. Use a fire extinguisher to combat a fire only if the fire is small. You can easily quick quick escape area. Then you know how to use fire extinguisher. You can stay between the exit and the fire so that you can always safely get out. Do not enter an area of flames and smoke in an attempt to rescue others. If trapped inside in a smoky room, crawl along the floor where there is breathable air. Do not open a door that feels hot. Do not use elevators. If stuck inside, turn off the ventilation system, stop towels or rags wet if possible in door cracks and vents, and use phone to report your location. Hazardous materials. Treat any unknown substances as hazard until proven otherwise. Avoid any spilled liquid or powder as well as possible vapors. When you see warnings, signs, or placards with flammable or other warning terms and any spilled substances, do this. First, stay out of the area and keep bystanders away. Outside, stay upwind of the area to avoid possible fumes. Call 911. Approach the victims only if you are sure if it is safe to do so. If it's safe to do so, give first aid for the chemical burn or smoke inhalation. Multiple victims. Trying system usually put each victim in one of four categories. First priority, critical condition, victims with life-threatening injuries who cannot wait for help. Second priority, serious conditions, victims with injuries that needs care very soon but may be able to wait for help. Third priority, stable condition, those with minor injuries who can walk. The fourth priority, obviously dead or dying, those who cannot be saved.